Freestanding emergency departments, they're becoming more common across the country and right here in Central Texas. In fact, St. David's Healthcare's latest freestanding ER opens in just a few weeks. So we wanted to know, what is the difference between one of these ER departments and urgent care centers? Joining us to help explain the differences is Dr. Robert Simpkins, the medical director of St. David's Emergency Center in Cedar Park. Good morning to you.
Good morning. Thanks for having me.
Thanks for being here. This is such a timely topic because they are popping up everywhere, different types of these freestanding medical facilities. And as a consumer, we're trying to figure out what the difference is.
Yeah, there is a significant difference. And so people have to figure out roughly what kind of problem they're having and what services they might need. Obviously, you're not going to be perfect about it, but it's the more efficient you are at selecting the right facility, the more cost-effective it's going to be for you, maybe the more timely it's going to be for you. I really divide them into three levels.
Okay.
You have your very basic levels that you'll see, the ones that are in the grocery stores, in the pharmacies. They're very basic services. You have a sore throat, you might have a urinary infection, they can do very limited testing. Then the urgent cares that are generally open just day hours, maybe 12 hours during the day, they can provide a next tier, very simple lab testing, x-rays typically. So if you have a sprained ankle, maybe you think it might be a hairline break, that would be very appropriate. When you get into the more complicated areas, you're having chest pain, you're having abdominal pain that might require more testing or fancier imaging, you really need to be at that next level. So your choices are really a freestanding emergency room or a major emergency center, like a traditional hospital. The advantage of the freestanding is often the wait time is less. And if you look at particularly our system, our services at a freestanding ER are almost identical to what we can provide at the major hospital level.
Okay.
We have CAT scans with radiologists reading in real time for us. We have x-ray. We have full labs, not just the basic labs. I can do almost any lab test that I can do at the main emergency room when I'm working there. We have on-staff radiology techs, lab techs. We have ultrasound available 24 hours a day within just a few minutes. So we can take care of much more complicated issues. I can set a fracture. I can sedate a patient to set a fracture or repair a complicated laceration. We can evaluate for stroke. We can evaluate chest pain evaluations. And if in fact somebody needs to be hospitalized, we've got very efficient methods of transferring them directly to a hospital of their choice to be admitted, and then you can bypass the emergency room. And often that process is a lot more efficient than going to the emergency room where you might have a trauma case that takes precedent and you have to wait an hour. Okay,
we really have 30 seconds left, but the cost, you mentioned the cost being different.
The cost is, for most people's plans, an urgent care and an ER co-payments are different.
Okay.
So if you really think you have a minor problem, an urgent care is the way to go. If you realize it's a more complicated issue, like abdominal pain, chest pain, whatever, then if you're going to go to freestanding, you're going to pay an emergency room copay, but you're really going to get emergency room services. So that's the difference. So if you really think it's minor, I would recommend one of the lower level care facilities. If you know it's a more complicated issue or you're concerned it is, I'd recommend a freestanding or a full emergency room department visit.
All right, good information to know. And calling ahead may not be a bad idea either if you're on your way. I know time is of the essence.
If you can, but most of the time we can get people in very, very quickly.
Okay.
Except of course the main emergency rooms on occasion.
Got it. But calling ahead if you have questions, hey, can you treat this? Right,
and we've got our new one's opening in Cedar Park this coming week or two. We've got a grand opening today from 10 to 1, and I'm really excited because it's going to bring a level of care that they don't have right now in Cedar Park.
All righty, Dr. Simpkins, thank you so much for being here.
Thank you so much for having me.